So guys, let's quickly look at the relevance of chemical pathology to medical practice. All right, basically like why do we actually study chemical pathology? All right, so that's what we'll be looking at. And basically students in an exam were actually asked to actually write about the relevance of this branch of what pathology, which is a chemical pathology. Okay, so let's have it in this lecture so that at least you guys can have the knowledge, and um, whenever you meet a question as like this in exam, you can be able to actually what take it out. Okay, so the question was asked like this: write on relevance, or write on the relevance of what chemical pathology to medical practice. Okay, so chemical pathology is basically like this. You are basically trying to look at the biochemical basis of what diseases, okay, so that you can be able to diagnose diseases and treat them, okay, from the chemical point, okay, and it forms the basis of medicine for real, okay, because if you can't make a diagnosis, um, you can't be able to actually what even know the illnesses that is wrong with the person, okay. So let's define it first. We said that chemical pathology is a branch of pathology dealing with the biochemical basis of disease and use of biochemical tests for screening, diagnosis, monitoring, prognosis, and management of diseases. Okay, so mostly this is done through what analysis of body fluids like what blood and urine. Okay, so now I will say this is dealing with the biochemical basis of disease and use of biochemical tests for diagnosis and management. Still the same thing. All right, so okay, I think the importance starts here. Okay, so now so that in many diseases there are significant changes in chemical composition of body fluids, such as what raised blood enzymes. Okay, for example, there's rise in what creatine kinase in cases of what muscle inflammation, and rising sugar levels in diabetes mellitus due to what lack of insulin. All right, so there's no insulin to basically facilitate the breakdown of glucose. Do you understand? All right, then chemical pathology department within a hospital provides a link between the frontline clinical staffs and the basic sciences. All right, so they also employ analytical and interpretational what skills to aid the clinicians in prevention, diagnosis, and treatment of what diseases. Right, so this is just how the process looks like. Also, diseases such as what heart attacks, kidney failure, viral infections, bacterial infections, infertility, diabetes, high cholesterol, and inherited metabolic diseases, thyroid problems, and even increasing or decreasing what drug levels to make sure people are on the best. Okay, so all these are some of the areas where clinical chemistry laboratory becomes what involved in treatment of a patient, okay, or a person. All right, so also some regional laboratories are involved in screening services such as what testing for phenylketonuria and cystic fibrosis in new babies, also genetic screening for mutation, and also screening for what illegal drug use. Okay, so that's basically all the set of what relevance of chemical pathology to medical practice. Okay, so bye for now.